organisers very much for having me, and to all of the sponsors. It's wonderful to be here in Thailand. So I got given the talk title of Amplify, MRI and Diffusion, so it's been changed. There's been some wonderful talks already, including those by Dr. Chanon about diffusion. So just today, I'm going to be talking about amplified MRI and a new approach called ultra-high contrast MRI. First of all, I just want to say hello, Thailand, from New Zealand. As Dr. Rushcombe mentioned, I'm from Ngātai at the University of Auckland, which is in the North Island of New Zealand. It's not too far from Thailand. And we're based at in Gisborne. It's on the east coast of the North Island. It's a very small town. And just a little bit of an anecdote, your very own Professor Cowan Setson-Potts spent his teenage years in the west coast of New Zealand. And so it's a lovely link. Not only is Professor Cowan from Thailand and America, but he's also a New Zealand Kiwi. So as I was actually talking to Dr. Chanon last night, and he was telling me how he's got 22 scanners in his hospital. And so I thought I'd put this slide up here to show that this is the town that we're from. It's a town of about 40,000 people. And it's only got one traffic light, but it's got two MRI machines. So one is in the public hospital, it's a 1.5 Tesla Siemens system, and at Matai we've got a 3 Tesla GE system. And it's a place in New Zealand which has a disproportionately high burden of health conditions and poverty, even though it's actually a really beautiful place to come. We've got beautiful beaches, so come and visit us if you come to New Zealand. And it's an interesting town. This is our claim to fame. We have a runway that runs over a railway track that runs over the runway, and then the planes give way to the trains. So that's our claim to fame. So as I mentioned, we've got a 3T GE system, and so all the images that I'll be showing you today are from the GE, so just assume they're 3T images. And we do mostly brain imaging in our research centre, so here's just a range of different projects we're working on. I'm only going to be talking about these two today, amplified MRI and ultra-high contrast MRI, but there's other methods, other research programs including ADHD, there's eye disease projects, we've got a project looking at methamphetamine recovery, and in particular we're doing a lot of work in concussion. So please come up to me if in the break you'd like to talk about any of these other topics. So I'll get started with amplified MRI. So just the idea for amplified MRI came from this group from MIT, which were working on a way of amplifying real-world video. So the subtle changes, subtle subvoxel changes in real-world video. So what you see here on the left is a video of someone's head, and as you know, every time your heart beats, that flows into the brain, and there's actually a little bit of wobbling motion. If you amplify that motion, you can start to see, actually your head is sort of, as you're watching me now, your head is kind of wobbling on its neck. So so essentially what this does is uses a type of video magnification algorithm called Eulerian video magnification to amplify those very subtle motions in those videos. So we saw this was actually a wonderful TED talk, which I do encourage you to watch. We saw this TED talk and we thought, gosh, after all, you can acquire MRI movies in the form of a cine MRI. So you all know about the cardiac cine MRI method, which gives you a lovely look at the dynamics and function of the heart. And so we thought, we can actually do cine MRI of the brain because we can maybe amplify that motion to reveal that subtle motion in the brain that could change due to pathology. And just so you know, so normally these cine MRIs are around about 1.2 millimeters in terms of the resolution, but because the brain only moves about 0.14 millimeters, that motion is subvoxel, so you can't really see it. So what we thought is, why don't we use this technology to be able to amplify that very subtle motion in the brain, because the basic underlying thought we had was that pathology might alter the the brain motion and give us a different way of looking at brain health. So we took a cine MRI, so it's just a cardiac-aided cine. You put the pulse oximeter on the finger and this is around about a 2 or 3 minute sequence to get whole brain. And then we amplify the motion by, in this case, it's about 25 times to reveal this very subtle motion of the brain. So you can see now you get the brainstem moving downwards, the spinal cord and the cerebellum sort of moving downwards. This kind of piston-like motion that you can see with a little bit of cortex motion there. And so the original application of amplified MRI was in 2D. It's a multi-slice cine method. But more recently we decided to try and turn this method into a 3D method. We acquired volumetric 3D data and actually alter the algorithm so it actually captures motion in all 3 directions, not just in the in-plane direction. So this is the slight improvement here. You'll see this is the original implementation where there are artifacts that are due to through-plane motion that were not picked up by the algorithm, partly because of partial volume effects and partly because we're not actually adequately capturing the motion in the through-plane direction. So if you acquire volumetric data, so ideally you want to get isotropic data, so we use 1.2 millimeters isotropic resolution. And then if you apply the 3D algorithm, you can start to see that the artifacts go away and it sort of cleans up in these areas here. So the bottom line, it is possible to do amplified MRI with 2D, multi-slice, but you do end up with these some sort of errors. In fact, this is an area here in the scalp here. This is not real at all. It shouldn't be pulsating that much in the skull. So it kind of cleans up that motion in the skull, just like with the skin area. So the neat thing about the 3D approach is that because you can acquire it in the spatial plane and you can reformat and get really nice looking images in all 3 directions. And so if you look at this, so we normally were looking at the sagittal planes, but there's a lot of really neat information that you can glean on the axial or renovate those axial slices. You can see that sort of squeezing like symmetrical motion, which is characteristic of a healthy kind of pumping away of the brain. You can see this coronal image pumping up and down here. So now we still acquire in the sagittal plane, but we always reformat to see the motion in the other planes. So it's quite hard in one slide to describe the algorithm. I'm just going to really high level explain how the algorithm works. But I do encourage you to read the paper to understand how it works. But what you do is you take the cine MRI data, and these are spatially decomposed into different pyramids. It's using the Laplacian approach to decompose this input cine data. And then you need to bandpass filter, and that's a bandpass filter in the temporal direction. And that bandpass filter is set to cover a reasonable range of the cardiac beat, so it's the fundamental frequency that we amplify. And then what you do is you select an amplification factor. We typically select about 30 of amplification factor, and those amplification is applied to those spatially decomposed, temporally bandpass filtered scales here, and then they are then added back to the original data, then collapsed back to form the amplified MRI image on the right there. And just recently, my old research assistant at Martin Wren, who also happens to be now Carmen Setzenpop's student, he's developed a quantitative displacement estimate where at this point in the flow diagram he is quantifying the motion by solving the optical flow equation over the coefficients of the Laplacian pyramid. So what you get is you get these really nice heat maps here which give you that quantitative displacement that we couldn't get before because it was very much a visual method before. So this is the results from the quantitative 3D amplified MRIs. So here what we do is what you've got your 3D cine data here. What we do is we always amplify that data so you can visually see that motion. And on top of that, we then produce an image that shows that quantitative displacement map. So here we've just overlaid the quantitative data on top of just a single frame, just to show that motion. So red in this case means up, and blue means down. Here, blue means to the left, and red means to the left, and blue means to the right, and so on. You can see that sort of motion, the quantitative motion. Some ROIs to get to you understand what type of motion you get. So some of you might be familiar with the phase contrast method, which is typically used to look at blood flow, or in some cases CSF flow, and just how that compares. So if you use a phase contrast method with a velocity encoding gradient slow enough to be able to pick up the slow motion of the brain tissue, this is the data you get. So you get that, you can see the white and the grey here is like that squeezing-like motion. White and grey here means up and down, so that's that piston-like motion. And here you can see that piston-like motion here. So it quite nicely matches that of the phase contrast MRI in terms of its motion characteristic. And the neat thing about the amplified MRI is that you can, while this is a true sort of acquisition-based method that quantifies a directly quantified displacement, here you can visualize it, and you can visualize it with respect to the anatomy as well. And it gets very high estimates, it's based off a Galaxy P method, so it's a nice visual way of kind of looking at something, the gold standard, I guess, which is the phase contrast method. So just in terms of the advantages and disadvantages, it doesn't come without some disadvantages. The source of the MRI signal is very complex, so it does depend on the heart rate, and so that is something you would have to remember. But generally it's quite, there's Itama's done some experiments with test variability that's generally quite stable in terms of its repeatability for a person who's scared over a couple of days. And the advantage, I guess, is that you can do 3D. It's quite hard for some of the sort of acquisition-based methods to be able to achieve high-resolution 3D data. You can see the motion in all three planes. And also, what we haven't really explored amplification of other frequencies. You can actually tailor the algorithm to be able to isolate specific frequencies of the motion. Typically, when we always use the fundamental harmonic, so the heartbeat, to look at that motion, but there is opportunity to explore other frequencies. And you might be also wondering, in terms of physical challenges, we've looked at unprocessed cine MRI data, pre and post challenges, and it's very difficult to see that change in the motion, but you do really see a change in the motion with challenges. Applications, there's a range of things our group and collaborators are looking at. So one of the big projects we've got is on our brain pressure. This project, which I'll briefly talk about. We've got aneurysms. This is a wonderful group from University of Washington looking at amplification of the wall motion of aneurysms to try to predict risk of rupture. There's Chiari malformation, diseases of big brain pressure people are looking at. We're using it inside our concussion impact simulations where we're using amplified MRI with DTI and T1 weighted imaging to improve the concussion simulations in rugby. And then we've got dementia as another application. In terms of brain pressure, this is a project which is very new, so we haven't really got some results. We've got some results, but we haven't finished the project yet. But what we're trying to do here is we're using a range of different imaging modalities, ranging from MR angiography, ASL, blood flow imaging, and CSF flow imaging, alongside amplified MRI, to see if we can come up with a non-invasive measure of brain pressure. And the idea here is to try and find a better way to help track people who potentially have a shunt and need to track their pressure due to shunts, and also an idiopathic intracranial hypertension where people had an increased brain pressure due to an unknown reason. So what we're doing is we're scanning people with IIH, and before they go in for a lumbar puncture. So we get a baseline scan with all of these imaging modalities. They go in for a lumbar puncture to get their brain compressed. We're scanning them again, and we're using computational modelling to see if we can use that data to be able to couple computational modelling to estimate the brain pressure. And we do have some results where we've scanned 10 people so far. We're not showing the results here yet, but we're seeing quite significant reduction in the brain motion with pressure. So that's quite promising as a potential biomarker of brain pressure. So Chiari malformation is another application of what we're doing. This is a work by Monique group and this collaborator at Sinai. And so what the goal here is to see if we can use amplified MRI as a way of helping to predict surgical outcomes due to Chiari malformation. And for those who don't know Chiari malformation, that's an extreme case of Chiari where you've got cerebellar tonsils dropping below the foramen magnum to essentially block the flow of CSF, and it results in this very unusual brain motion on amplified MRI. And so what this group did was scan 15 patients alongside healthy controls, and they found that there was an increase in brain motion in the areas, in these particular areas here, the cerebellar tonsils and the brain stem. And interestingly, so they looked at motion in all three directions, and interestingly, the subjects with a higher mediolateral motion, so this way, had improved outcome post-surgery. Now the numbers are still very small, so it's, we need to get more data to really prove that, but the point is that because we can see the motion in all three planes, it does open up opportunity to explore how motion can potentially affect surgical outcomes in Chiari malformation. This is another case due to potential clinical application, which is being led by Isma and Carlin at Stanford. And here what they're doing is they're scanning healthy controls alongside patients with different types of dementia. And this is quite interesting. So what you see here is just the unamplified images here. This is sagittal and axial. You can see it's very difficult to see the motion here. And so what they did is they amplified the motion by about 15 times. And you can quite see, if you look into the sort of, in the axial plane, in almost all cases they saw this kind of asymmetrical motion that was not observable in the healthy controls. So typically in the healthy controls you can see that very symmetrical ventricular motion, particularly here in this plane. And here you can see this sort of asymmetrical motion, which, and it kind of like, it's hard to see actually without the lights, but you can kind of see like a jelly-like motion in the parenchyma as well. And it's quite difficult to kind of really until you look at the quantitative maps. So if you just look at these quantitative maps, you can see this nice sort of symmetrical motion that's kind of squeezing in and out. Here, but if you look down at the quantitative, you can kind of see this asymmetrical kind of motion in the axial plane here, which was very consistent across patients with dementia. And Ismail reviewed, he's got 17 cases, but so far he's reviewed 15 cases, and he saw a statistically different pattern in abnormal pulsatile brain motion in patients with dementia. So you can see it here, it's all souped up here with that kind of asymmetrical motion you can see in the ventricle region. So we've also been very interested in the application of amplified MRI in concussion. And just high level, what we're doing in this project is we're scanning rugby players over a season. So we're getting data pre, during and post-season with a range of different imaging modalities. You can see them here, DTI, MRI, fluid flow, amplified MRI. And they're equipped with mouth guards, so we get a sense for impact over a season. These are mouth guards with sensors in them which can track the acceleration and translation during the game. And so what we're finding, just really very, very early days yet, we haven't analysed all the data yet, but what we're seeing is that the brain motion actually seems to it seems to decrease in the area of the corpus callosum and in some areas of the spinal cord. And we see that reasonably consistently, but we haven't really deep dive and analyse that data. But there is an interesting case that we've scanned. This is a rugby player, 18-year-old rugby player, who was scanned pre-season. If you just look in the coronal plane, you might appreciate the change in the motion. So this player came in, he had a concussion on the field, and then we scanned him. You can see this very asymmetrical looking motion in the temporal lobe area. It kind of tilts downwards that way, and you can sort of see reduced motion in this area. And then we scanned him 2 months after injury, when his symptoms had resolved, and you can see that motion has kind of come back to normal. And we scanned him again 5 months after injury, still his symptoms were fine. He wasn't experiencing any headaches or dizziness like he was here, but you can see definitely a very characteristic kind of movement to the downwards direction there. So another thing we're doing with amplified MRI is we're using the information in the amplified MRI coupled with the DTI and T1. These are our operators at the Northern Bioengineering.